So what is the trunk impairment scale? It measures motor impairment of the trunk after a stroke. It consists of 3 subscales: static balance, dynamic balance, and coordination, all in sitting. Most of the testing items are repeated at least once. On some of the items, the patients are repeating the same task over again to assess compensations. On some, the patient is asked to repeat the testing item on the opposite side of the body, and some do both of those things. Why would you choose it over the PASS, the Berg, or the mini-best? So the TIS has been studied, validated, and is considered reliable based on acute and subacute stroke populations. Some studies included chronic stroke populations while determining normative data. You might choose the TIS as an earlier outcome measure, as it is performed all in sitting, and therefore assesses only sitting postural control. The PASS assesses stability during changes in position and is sensitive for assessment of postural control in the first 3 months post-stroke. The PASS can also help clinicians discriminate between right and left brain involvement. Similarly, you would ensure successful performance on the TIS before having the patient attempt a Berg or a mini-best, where their balance would be challenged way more than in the sitting position. The TIS might be an outcome measure of choice if you anticipate the patient won't likely be standing for a while in therapy. Normal results. So the maximum score on this outcome measure is a 23, denoting a perfect performance, and 0 denoting the most minimal performance. The testing items vary between 2, 3, and 4-point scales, which I will address after each item as the video progresses. I have attached photos of how to score each item and have referenced them, as well as resources that I base the information I've shared with you here for normative results. Corrections in my performance as I've gone through editing this video. I could have moved closer to my patient as she was leaning down to either side, and could have held my hands out for increased safety. Even though I had the gait belt on her, I could have been closer to her. I should have also moved to her left side as she was going down to the left, rather than staying on her right side in the instance that she would have fallen down to the left. Alright, so today we're going to look at the trunk impairment scale, which looks at static balance, dynamic balance, and coordination of the trunk in patients after they have a stroke. So for the first subscale, we're looking at static balance. So I'm going to have my patient sit here. Her right side is the affected side. I have a gait belt on her in case I need to grab her. So I'm just going to have you sit right here. Okay. Okay. And then the next part of the scale is looking at, I'm going to cross her unaffected leg over the affected leg, and I'll see if that throws off her balance at all. Now for the third part of that subscale, I'm going to ask my patient to do that motion actively. So will you try to cross your left leg over your right leg? Okay. Alright, so this next subscale looks at dynamic sitting balance. For the first item, we're going to look at the patient leaning down to the hemiplegic side and back up to center, and then the second we'll look at leaning to the unaffected side and back to the center. Go ahead. For the first one, we're just looking at if she can complete it, so she would receive a grade of 1 for that one. Do it one more time. Okay, do it one more time. So the second, we were looking for if she was shortening on the unaffected side instead of the affected side, and then the third one we were looking for compensations at the hip. Alright, so now we're going to go to your left side. So do the same thing, lay down on your elbow. So this time we're shortening the unaffected side and lengthening the affected side. One more time. And one more time. Alright, so for these next couple tests, what I'm going to look for is if the patient is able to lift her pelvis on the affected side and then on the unaffected side, and we're going to be looking at if her trunk is shortening to the affected side on this one, okay? Go ahead and try to lift your pelvis up. Okay, so we're getting the shortening on this side and the lengthening on this side. Do it one more time. And on this second trial, we're looking for any compensations. All right, so now we're gonna look at the unaffected side. So try to do the same thing. So we're shortening on the unaffected side, lengthening on the affected side. Do it one more time. This second trial is looking for compensations. Okay. All right, so the last subscale is looking at coordination of the trunk. So we're going to examine how her upper trunk moves versus her lower trunk. So we're going to do 6 rotations of the upper trunk and 6 rotations of the lower trunk with the hemiplegic side moving first, and 2 trials of each. Okay, so go ahead and move your right shoulder forward first. Keep your head fixated forward. Okay. And again. Okay. All right, and now we'll move on to the lower trunk where her right knee is moving forward first.